So today we're going to be talking about the main reason that teenage girls go on birth control pills is actually not because of birth control. It's because they start having very painful or irregular cycles, periods, and therefore start with a lifelong addiction to pain relievers, 2 and 3 a day, 3 days a month, sometimes more. The birth control pills block the hormone pathways, so that can help symptom-wise, but then it doesn't help the body get back to its regular state of function. So there are natural methods of helping the cycle get back on track, and one of those ways is specific chiropractic care, adjusting either the upper cervicals or the lumbar plexus. So just real quick, I know that's why you brought your daughter in, and so you volunteered to speak today. So Michelle, if you don't mind just quickly explaining kind of what you noticed, and then I'll show the audience here how we adjust that.
Okay. Catherine started her menstrual cycle when she was about 12, and it just became progressively more painful for her. I didn't want her to be on medication, especially long term, because we don't use a whole lot of that, and I didn't want her to become dependent on it. So that was the reason that we brought her initially, and so many other benefits came from that, but initially that was what brought her, and we've seen a huge turnaround in just a short amount of time.
Yeah. 3-4 months where
Yep.
So we only have a few cycles to work with, but she's already showing the success. And also brought this poster out. So the lumbar part of the spine is where these nerves are. They join up and form the pelvic nerve. They branch off to the gonads or the reproductive system, and then also to the large intestine. So many times too, these girls are having unexplained bloating or cramping because it's on the same nerve route. Come on down. So we're really just checking for tenderness and alignment. We'll look at leg length, see if the body's starting to compensate or pull away from those irritated areas of the body. And Catherine, I'm going to have you just take a small breath in, all the way out. Great. One more time. All the way out. Perfect. Come on up. And it's really just that easy. Depending on the severity of the case, sometimes the repetition needs to be 3, 4, 5 times a week for a couple weeks, and then we reevaluate through tracking nerves, through testing like EMG, thermography, heart rate variability. Depends on the case, but if you know anyone who is starting birth control pills,